Hi, Dr. Kimberley Wilson, physical therapist here at Inspire Physical Therapy. I'm also a Mercier trained therapist and a Mercier fertility specialist. So, all things babies here at the clinic, and I love that work. It's such a blessing and such a pleasure to get to work with my moms and dads who are struggling with issues of infertility. It is so common, and a lot of times it's there's a lot that we can do without going down that traditional pathway of taking medication or any kind of harsh intervention for our bodies. So there's a lot we can do for our bodies to support that. But I wanted to jump on for just a few minutes and talk about one of the main issues that I see. And there's lots. Like, it's never just one thing. So it very much a holistic approach with what we teach here at the clinic, and we take each individual, each couple, and try to figure out what areas that we need to target. But I will say, it's always something that we address is the mobility, or how can we improve the environment in the abdominal area, right? So I'm thinking uterus, ovaries specifically. Those are the major reproductive organs that are found in the abdominal cavity. And I'm looking at restrictions. Why is that important? Well, you always want to, movement is essential because movement equals life, right? You got to have movement to have blood flow, to have a good nerve conduction, good lymph flow. And what we find is that the abdominal cavity can be very restricted. And so that's part of what our work here is, to help improve that. It's so important, and without that, the odds of conception are very much lower than they would otherwise be. Your organs need to be mobile so that they can do their job. If we have less movement, then we have less blood flow. And if we don't have efficient blood flow, then we're not going to have a very high probability of becoming pregnant. Did you know that during ovulation, the uterus itself has to sort of lift itself up into the pelvis to enable the fallopian tubes to kind of align, so that when the impeding follicular rupture happens, that it can sort of accept that? And then after ovulation occurs, the end of the fallopian tubes then have to contract, sort of in this peristaltic movement, in order to receive the egg. And then the tubes then wave the egg in sort of this flowy motion, where it can then become fertilized and then move toward the uterus. So there's a lot of movement that's required. It's this beautiful, flowy dance that needs to happen in the abdominal cavity. And if there is restrictions in any of those movements, then those reproductive organs then are not going to be functioning quite optimally. And so sometimes they need a little bit of waking up, a little bit of nudging. Like they're in there, they're sort of sleepily doing some of the work. You might still be getting a period, you might still be ovulating, but maybe not regularly. And but what Mercier does is it comes in with this manual approach, and it's like going in and just when you're trying to wake up somebody that's sleeping and you just can't get them awake, you'll go over and you just kind of give them a little shrug, right? It's time to wake up. And that it kind of wakens them up enough where they can go ahead and you can get out of bed. Well, that's kind of what Mercier Therapy does. It goes in and kind of gets things moved out of the way that's keeping those organs from working like they should be. a lot of a very common question that I get is like, why is it like this? Like, how does it get stuck in the first place? And there are a few reasons for that. One very, I guess, more obvious thing would be scar tissue. So if there has ever been an abdominal surgery of any kind, then that can produce scar tissue. And scar tissue is one of those things that, we can't see without opening the space up how bad that is. But it varies from person to person. And no matter how complex or how simple the procedure might have been, it still can produce scar tissue in the area. And then it varies from person to person. We might get a small amount of scar tissue, and then we might get a lot of scar tissue that kind of spider webs out. Certainly endometriosis can cause scar tissue and inflammation. And at any point where there is inflammation, that can cause some scar tissue. So it really depends, and I hate to say it depends, but it kind of does on each person, like what has gone in their body. But it's always something, even if we don't always know what that something is. And then a lot of times, maybe there's not a good rationale to say, well, there's scar tissue in here, but we still have those. A general term might be a myofascial restriction in there. And I work with a lot of clients who they're just dealing with those limitations, whether they be related to the muscle or the fascia or the ligaments, and over time they've just gotten stiff and not very mobile. And even if they can't pinpoint a certain trauma, some examples that could cause trauma in the area would be, falls as kids. We often fall on our tailbone. We might have been active in sports and fall on, and you just don't even think about those contributing to the tightness. But once an area becomes tight, specific, and as being a pelvic floor physical therapist, I see that a lot too. A hard fall on your tailbone can certainly result in a tight pelvic floor. And if we have a tight pelvic floor, then all of the contents within that pelvis then can over time have a response to that dysfunction. And then you've also got to remember, as females, we kind of have a monthly trauma, right? So the endometrium builds up into in the lining of the uterus because it's preparing for an egg that might potentially be fertilized. And if we don't become pregnant, then every month we shed that endometrial lining. That can be very traumatic. Some females experience more painful periods than others, but certainly shedding of the uterine lining, it's a big deal no matter how you consider it. And so there's sort of that monthly trauma, and that can vary from person to person as well. So those are just some things to consider when thinking about why am I stuck in that area in the first place? Like, why do I not have good movement in there? Why do I not have good blood flow? Certainly stress, our daily stressors, depending on, that varies from person to person too. But all those things in combination can really result in a stuck abdominal cavity and all the contents that are inside there. So lots to think about. And so Mercier is very effective. It's been researched well. It is hands-on. Like, I'm going to be hands-on with you, and it's not a feel-good treatment. It's not like, going in for a massage and it just feels so good. It's not going to be like that for sure, but it's so effective, and with really, really, really good results. And it's so much fun to work with somebody, and then, you know, you get that call or you get that text, oh my gosh, I have a positive pregnancy test. And then, you know, go on to see a happy, healthy baby being brought into the world. And it's just it's a beautiful thing. And I love it so much because it allows me to equip you, the mom who is looking to become pregnant, and you know, you just want your body to do what it's designed to do. And so what's beautiful about an intervention like Mercier is that it gives you all the tools to take responsibility for your own fertility. You know, it gives you agency. It makes you feel stronger. It gives you clarity. It helps you to feel more connected to your body. When you are done with this treatment, you are going to feel so much more connected to your body. You're going to feel all the things. And it's just a beautiful process to see, to take, you know, take you along this journey of discovery for your body. And then it allows you to become more authentic in who you are. And you know what? Once you take this journey and you start to become more connected to your body, you can handle whatever comes your way. You can. We will, you know, we do so many things. We start to monitor your cycles really, really closely. We're going to test your hormones. You are going to be very connected, and you're going to learn so much about your body and the hormones, and you're going to know what they're called, and you're going to know what needs to be elevated when, and you're going to know when you're healthy and when you're not. Your cycle is your fifth vital sign, and you should know how to monitor it, and you should know how to monitor it really, really well. And you're going to learn what signs to look for with your period and with your ovulation. And you are going to feel like you are in such control of your body. And it's just a powerful and beautiful thing. And so I'd love to take you on this journey and share this process with you. And so if you are somebody that you know is struggling with issues of infertility, I mean, it's a no-brainer. Don't hesitate. Give us a call. It's a wonderful program. I believe in it so much because people get pregnant. People get pregnant who have been struggling to become pregnant. People get pregnant with Mercier Therapy after having tried all the other things sometimes, you know, the IVF and the fertility medications, and sometimes that doesn't work because they're not addressing the root cause of the infertility. And so that's what we do here. And I would love to share it with you and help you along your fertility journey. It's a beautiful, beautiful process. So I hope you enjoyed this video. I hope it gave you some things to think about, and I hope you had some takeaways, things that make you dig a little bit deeper and ask a few more questions. And you are in control of your body, and you don't have to wait for a doctor to tell you what you should or shouldn't do. You can take the steps needed today to move you toward a healthier lifestyle. You can take the steps today that will improve your chances of becoming pregnant. You are completely in control of this. You know, ultimately, this is God's business for sure. But here at Inspired Physical Therapy, you know, we can give you the tools to be in charge of all of that. And we look forward to seeing many, 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 many more babies born into the Mercier family. So I hope this video encourages you and blesses you and gives you great things to think about. And I'll talk to you soon. Bye.